Disorders of consciousness and brain injuries can be some of the most devastating injuries. They impact our basic needs, our need to think and move and speak. And so these were core functions and abilities that I wanted to help patients regain at their most vulnerable time. Our Amicous program stands for the Assessment of the Minimally Conscious, is designed for the severest brain injury patients or patients who are in a disorder of consciousness. Oftentimes, patients come to us with an unclear diagnosis as to what level of disorder of consciousness they're at. We evaluate our Amicous patients through a comprehensive interdisciplinary team evaluation that is comprised by neurologic evaluations completed by our physicians, as well as functional assessments completed by our therapists. And those therapists include physical therapists, occupational therapists, and speech therapists. We conduct these evaluations multiple times a day and over the course of multiple days because we know that brain injury patients are going to fluctuate in their presentation day to day and even minute by minute. A traditional rehab program requires patients to be able to actively participate in 3 hours of therapy a day and follow commands consistently. We know that our disorder of consciousness patients are some of the most severely injured brain injury patients and might not be able to follow commands or participate in that way. However, these patients do benefit from a rehabilitation program, and we can engage our patients in different ways. We use sensory stimulation, physical medicine rehabilitation, and neuromodulation to help our patients. Emergence from a disorder of consciousness is defined by a patient being able to either consistently communicate functionally or demonstrate functional object use. If a patient progresses and emerges from a disorder of consciousness, they may transition into our traditional inpatient rehabilitation program, which may entail several additional weeks of therapies focused on higher level tasks. One of the most important members of our care team is actually a patient's family member. When a patient goes through a catastrophic event, of course, their lives are changed, but also their families' lives are changed, and we try to help provide support and guidance. We focus on family and caregiver training, so families feel supported when they take their loved ones home. Our brain injury physicians at Shirley Ryan AbilityLab are uniquely trained to care for patients across the continuum of care, from consultations in the ICU, acute care setting, to the outpatient setting, where we may get to follow patients for years after their injury. Our intent is to instill hope and give all of our patients a chance for recovery. We always say that it's very much a marathon, not a sprint, and so we do celebrate those little moments along the way. Some of the most meaningful moments for me have been when a patient who was in a disorder of consciousness later tells me that they knew I cared, even when they couldn't communicate. I have seen patients who, by their imaging and diagnosis, were told that they weren't going to progress, and they're able to go on and live very meaningful and fulfilling lives, get back to their relationships and work and all the hobbies that make them who they are. And it is such a pleasure to be able to try to help treat them at their most vulnerable time in life.